It's just such a pleasure to be here in my home community. I've lived here since I was 7, and I'm going to share some stories with you because there's some of you in the room who I recognize. Some of you I know your names, some of you I recognize because you've actually been critical in my life path from an exercise perspective or otherwise. And I'm going to anchor those in some really simple black and white messaging. So you'll see in my slides that what Rosalind has shared with us, it's so simple. We all know this. But the difficult part is the systems that we live in and the structures that we live in and the fear-based structures that we live in make it not simple. And so the goal today is to learn on an individual level how to really reinforce that for ourselves so that we can propagate it out to improve the systems that we live in, to make it easier for everybody. So the big 3, I can't talk about the big 3 without talking about the big 1. And the big one is sleep. I'm a really good sleeper. It's a superpower that I have, and it's a superpower that I have because I need it in a big way. I function in a really, what I would call high-functioning anxiety most of the time, which means that if I don't get really good sleep, it doesn't go over very well in my life. So sleep is key for everybody. Sleep is key for some people more than others, and some people need more and some people need less, depending on how they function in the world. Sleep, sleep, sleep. So please make sure that you get sleep, and you encourage others around you to get sleep on a regular basis. And the big 3, make sure that you get good sleep. If you're taking good care of all 3 of these big 3 things, you're going to get good sleep at night. Laughter is really important, but it's not on the slide. If you're doing the big 3, you're probably laughing more. So make sure you're doing those pieces too. So before I go into them, the stories that I do want to, quick stories that I want to share with you is one. So I have a public health background, and Chief George is no longer with us, but I did really want to thank her and our nation, Squamish Nation, for the prevention work that they've done for our community. So in the 2000s, I had the pleasure, a mid-20-something-year-old, to sit on the Spirit Committee for the Olympics. And at the time, we were talking about building the Spirit Trail across the North Shore, so to connect Horseshoe Bay to Deep Cove, for those of you who know this place. And the Squamish Nation led the way on that project. They were the first to actually build the pathway that many of us who live in this community enjoy, that connected from the Lionsgate Bridge to, for those of you who don't live in this community might not know, but through to about Fell Avenue, about that area. And that created the roadways that I use a lot in the community to commute along the lower banks, and it really is prevention based. It really does allow us to move in a way across our community, and it means a lot. And thank you for leading the way, Squamish Nation, for doing that. The other way they're leading away from the prevention perspective is around public health. Is we're supposed to not drive around in cars at 50 kilometers an hour. We're supposed to drive around in cars at about 30 kilometers an hour. And if you live in this community, you'll know that when you drive along the Capilano area, that it's 30 kilometers an hour. Now, busy mom, I commute. I'm driving to pick my daughter up from dance all the time, and I have to slow down to 30 kilometers an hour. I do have to gulp and take some deep breaths and know that the 1 minute or maybe 30 seconds to slow down to 30 kilometers an hour, sometimes in our busy state of mind is hard to do, but that is leading the way in prevention and public health. So just a real acknowledge to the Squamish Nation in our community and leading the way in those prevention pieces. So the first one, exercise is medicine. So exercise is often attributed to our physical health, but I would challenge you in the room to, if you closed your eyes and you thought about yourself being physically active, you're likely in a meditative state going for a walk or going for a run. So you're addressing your spiritual health, and you're also addressing your mental health at the same time. Often in our society, we like to get 2-fers or 3-fers and things. So when I exercise, I often try to make sure that it's a place of connection. So I often try to do it with a friend. And it means that we're going for a walk and we're having a chat, or maybe we're going for a run and we're having a chat. Or maybe we're lifting weights, which is harder for me to want to do, so I really got to make sure I have a friend to do that. Just setting yourself up for success in that way. The other one is food is medicine. So as Rosalind so gracefully taught us about, having access to food, local food, is so, so critical. And, really, ultimately, if you're on the land, living off the land, lifting and accessing food that way, you're taking care of all those pieces at the same time. And connection is medicine. So we heard a little bit about screen time at the beginning of this. Really, screen time is really actually our call for trying to connect. And really thinking about how to create connection with each other and allowing it to happen that way in some way, shape, or form, but to the nth degree. The big thing about these three is that everything in moderation underscores all of them. So, exercise in moderation, more is not more. It's not necessarily healthy to go out and run a marathon every day. Food is, food, same premise applies. And connection, if you're an introvert like me, you probably don't need to be with people all day, every day. Bear that in mind as well. So the main thing I want to make about these 3 points is that they all build up resilience factors that enable us to move through life with all of the adversity that we face and all of the stresses that we face every day. It's easier to employ these in life if you learn them when you're young. So I'm really fortunate. In this not this very building, because I'm old enough that this building didn't exist when I was a kid, but in this very spot, I learned gymnastics. I learned how to go on the beam. I loved it. I'm a kinesthetic learner. It's why I do what I do today. And so it's easy for me to access exercise. I learned it when I was young. It was reinforced, and I access it as something to take care of myself. Food, I will say, admittedly, I grew up in the 80s, and convenience food was very prevalent in the 80s. So it's not as easy, I would say, for me to access food as medicine because I didn't learn how to grow vegetables and how to do some of these things when I was young. And that's not to blame or shame anyone. That's just to say that that was the environment that I grew up in, and I find it's not as easy for me to access that as medicine now that I'm an adult. I'm conscious of that. I'm trying to learn how to do that. I'm growing some peas. I'll let you know how it goes. And connection is medicine. So again, this is the one that I worry the most for all of us about. We need to be together in person. We need to be together with our loved ones. And so let's try and propagate that and reinforce that. And the main point there, as I said, resilience is easier. Those factors for resilience are easier to access when you're taught them when you're young. Folks who were born in the 1950s or earlier, you know these things, you know how to do them. Please reinforce them with the young folks that are here today. Please teach those pieces because we're so hungry for them. And let's build systems that support them. So the next slide, the dose. So you'll see on here 7,500 steps. I put that there to be a little bit provocative. So most of you are going to say, whoa, 10,000 steps, like I track it on my iPhone every day. Well, actually, there's science to say that there's diminishing returns after 7,500 steps. The reason that it's 10,000 steps is because it's great for marketing. This point here is just to say that misinformation in health is prevalent. It's been prevalent for a very, very long time and is increasingly and actually very harmfully prevalent nowadays. Lifting or muscle strengthening 2 times a week, that should be a fairly straightforward thing to do if you're lifting groceries and moving those things around, or you're working in your yard, or you're squatting and bending and doing those things. If you're not doing that, if you want to go to a gym on a regular basis and do those pieces, 4 years in kinesiology, there's nothing I feared more than sarcopenia. Your muscle wasting and your bones being brittle and all of those pieces over your lifespan. So please make sure that you're trying to build that into your life in some way, shape, or form. And the last one, and the one I'm learning more acutely recently through Dr. Melissa Lem, who is the chair of the Canadian Association for the Physicians for the Environment, she lives locally here in Vancouver, is that we actually only need to be in nature 3 times per week for 20 minutes to watch our cortisol just go like this. If you're in nature for 20 minutes, your cortisol level is going to drop better than any Western medicine intervention can. This is not a tall order. And it's amazing. So off we go. and mix it up. Every movement matters, and make sure you're playing. And if you are getting all of these things, the call to action here are your loved ones. And if your loved ones aren't getting it, make sure that you're supporting them to get it. And if all of your loved ones are getting it, then I think you've got some resilience capacity to ensure that those in your community are getting it. And if your community is getting it, then onwards we go. And so with that, next slide. So I have an Irish and Scottish background. I cannot help but rhyme. So the soapbox that I will always stand on, but stand on the shoulders with all of you today, is to say that we absolutely, to save ourselves from ourselves, need to get as loud as we can about prevention and be as proud as we can about our community. Thank you very much.